and welcome to this edition of Border Report Live. My name is Rudy Mireles, and I am your host here in Harlingen, Texas, in the Rio Grande Valley of deep South Texas. Got a great program lined up for you today. A little later in the program, in just a few minutes from now, really, we're going to have our South Texas correspondent Sandra Sanchez speaking with the president and CEO of the Alta Care Foundation, Dr. Rashmi Chandran. They're a nonprofit that helps underserved populations here in the Rio Grande Valley get access to things they need. So looking forward to that conversation starting in just a few minutes. But first, as always, let's go ahead and take a look at what's trending across the border, starting with a federal judge ordering a senior U.S. Border Patrol official to meet her daily so they can talk about how things during the day went after weeks of confrontations between immigration agents and the public in the Chicago area. U.S. District Judge Sarah Ellis also told Border Patrol Chief Greg Bovino on Tuesday to produce all use of force reports from agents involved in Operation Midway Blitz since September 2nd. The sweeps have produced more than 1,800 arrests and complaints of excessive force. The judge also chastised Bovino over weekend reports that Border Patrol agents disrupted a children's Halloween parade with tear gas on the city's northwest side. Neighbors had gathered in the street as someone was arrested. She told Bovino, quote, "Children at a Halloween parade do not pose an immediate threat to law enforcement officers, and you cannot use riot control weapons against them." Also happening, U.S. Transportation Secretary Sean Duffy warned this weekend that he's about to make good on a threat to revoke millions in federal funds for California because he says the state is illegally issuing commercial driver's licenses to non-citizens. Duffy said Governor Gavin Newsom has refused to comply with Department of Transportation rules that require the state to stop issuing such licenses and review those already issued. Duffy said he would pull $160 million from California. He said he also has the option to pull California's ability to issue commercial driver's licenses. A spokesperson for the California DMV said the Trump administration has no legitimate basis to withhold federal highway transportation funds. Also happening all across the country, protesters have filled city streets voicing their opposition to President Trump's immigration policies of deporting millions of immigrants. And in Oakland, California, activists took their message off the land and onto the water. They protested near the shores of Coast Guard Island, which is a century-old artificial island owned by the government and houses a U.S. Coast Guard base. At sunrise, dozens of kayakers paddled through the Oakland estuary with signs that read, "No ice in the bay," opposing the deployment of federal immigration agents. Activists say they plan to continue protesting, now calling on their neighbors to step up too. Time now to bring in our South Texas correspondent Sandra Sanchez and our guest for today's program, the president and CEO of the Alta Care Foundation here in the Rio Grande Valley, Dr. Rashmi Chandran.
Thanks, Rudy. It's great to have you, Dr. Chandran. Thank you for coming.
Thank you for having me.
So you founded in 2023 a nonprofit called Alta Care Foundation. You help underserved populations in the Rio Grande Valley access health care, nutrition services, essential services, transportation, and we want to touch upon all of those aspects. Give a little bio on you. For 15 years, you were a healthcare executive in the Rio Grande Valley, so you know your way around the medical world. And Alta Care Foundation has a really packed board. I was noticing Sister Norma Pimentel. We've had her on the show a couple times from Catholic Charities. She's on your board. Former Senator Morgan Lamantilla is on your board. So you all seem to know what you're doing there. I wanted to jump off very quickly with regards to what's going on today. As the government shutdown continues, there's a prospect of 3.9 of millions of people losing their SNAP benefits starting Saturday. 1 in 8 Americans actually receive Supplemental Nutrition Assistance Program help. And in the Rio Grande Valley, it's, I understand, 310,000 people in 3 counties here. So, you know, this shutdown could greatly affect a lot of people. Let's talk about it. What does your organization do, and what are you preparing for should we not have any more SNAP payments come November 1st?
Yes, thank you for having me here once again. We started this organization 2 years ago, so October marks our 2-year anniversary. Like you mentioned, a lot of community leaders have joined hands in this mission. My background being healthcare, working for a large healthcare and hospital system, what I realized that a lot of issues related to healthcare is because of the poverty and disparities in social services. So what makes us unique, what we're trying to do is go to the really underserved and rural areas of UTRGV, of RGV. We base our research on UTRGV's paper, which divided the colonias or rural areas into red, green, and yellow zone. Red zone areas are the most underserved, where most services are not being given, organizations are not aware of them, and for that matter, they're not on the map either. So one of them being La Sara in Willacy County. We are in San Carlos in Hidalgo County, trying to do our gap analysis in La Feria, Santa Rosa area in Cameron County, and more to come in Stark County. So we are spread out in the 4 counties, trying to really reach those untouched, underserved areas of RGV. So here, after doing the gap analysis, what is the most pressing needs are those that we try to target. We try to bring organizations and do partnerships, MOUs with organizations that are actually serving those direct services. And if they have not been connected to these areas, we bring them to these areas to serve those needs. And what's not being served after those connections is our direct services. So food distribution, food deserts, that as it is, without even the shutdown and, SNAP benefits being cut, obviously we are one of the poorest counties in the country, Cameron and Willacy being on the top and Hidalgo following that. We are double in the percentage of poverty rate compared to the state of Texas. So we already have a lot of food deserts, and the areas that we serve are amongst them. So we had started planning to do food distribution days in those areas to begin with, one of them being more important in San Carlos. But right now what we're brainstorming is that we have budget accounted for so many of the already underserved food deserts. What do we do when that count triples? Because as you mentioned, there is a huge population that relies on the SNAP benefits here. So the good thing about the Valley is when there's a crisis, everybody comes together. So we are getting a lot of traction with the community leaders and other organizations that want to come together and pull through to come up with solutions that we can locally resolve some of these issues. But it is a big, huge undertaking. And a lot of brainstorming and fundraising to do towards that to serve the many families that are affected by the shutdown.
So let me ask you, does AltaCare work with, say, local food banks and help to put out drives, or do you physically put the drive out yourself, or do you connect the people who can help the other people?
Yeah, as an example, we are collaborating the upcoming food distribution with an organization called El Mesion. They are a food pantry that is certified by the food bank. So they are located at another part of Edinburgh, which is far away from San Carlos. So it is difficult for that population to actually go to the center and get the food. So what we're facilitating, and we have a partnership going on, is that we will be assisting with the funds and resources that El Mesion will require to make this food distribution happen, and we will facilitate the transportation of that food distribution and a monthly budget for the 50 to 75 families that we intend to serve in San Carlos.
So I met you last week at an event at UTRGV, Tacos and Tripas, and there were a lot of heavy hitters there, a lot of politicians there, although it was not a political event. And so that's kind of what you do, movers and shakers and connections. And knowing the people who have the ability to help other people. So, and telling them, I guess, of areas where that need more assistance, right?
Absolutely. I mean, what you don't know, you don't know. And we do have a lot of community leaders here who want to help and who are looking ways to give. But we are a newer organization, so spreading the word and ensuring that we are that convener and collaborator that you can get in touch with. And we will make sure that the funds are allocated or resources are allocated to the cause of your choice is something that I am working on ensuring that our community leaders are aware of.
Just Texas Democrats have actually in the state legislature formed a committee on Texas hunger crisis, and it's actually co-chaired by a couple representatives from Houston, but a member of the 15-member committee is Representative Armando Martinez here from Weslaco. So I'm sure he's somebody you're probably going to be reaching out to, to talk about how you can connect and how you can let the Texas legislature know of the need down here, right? Is a committee like this long overdue? Does everyone know in Austin what the Rio Grande Valley is going through, border communities, as far as hunger and poverty?
Yes. So as a matter of fact, Representative Martinez was supposed to be a part of our health summit that we had in Harlingen last month, September 4th, Accelerator. Because of legislative commitments, he couldn't make it, but we are scheduled to have a meet with him. But to your point, yes, we also collaborate with Texas Health Institute from Austin, who are heavily involved in the legislative voices in Austin. We have several partners, big non-for-profits from Houston. So we try to partner up with organizations from outside RGV as well and bring their services here. And, like you mentioned, the perspective that they have about border communities, the immigration issues is very different from what we live on a day-to-day basis. I mean, more than illegal immigrants, these are residents. These are citizens who may have less documentation, but they are people of the soil, and they are the ones who are suffering. So once they get that perspective from us, they're all in and they want to advocate. And we have partners who, like I said, are stationed. Their brick and mortar is in Houston, but they bring their mobile services here in our colonias and serve our residents.
We're speaking with the president and CEO of Alta Care Foundation, Dr. Rashmi Chandran. We're going to continue the conversation after a quick break. Border Report Live is back in 1 minute. Welcome back to this edition of Border Report Live. My name is Rudy Mireles. South Texas correspondent Sandra Sanchez joining us, as well as our guest for today's program, President and CEO of Alta Care Foundation, Dr. Rashmi Chandran.
Dr. Chandran, we were talking about nutrition assistance, SNAP, going away, but a big problem, a big concentration of the current government shutdown has to do with the Obamacare health care subsidies. Democrats saying that they want these subsidies to continue, and that is a fight in Washington. And there is a fear that premiums are going to go up and that people are just not going to be able to afford health care. Your organization focuses on providing essential services to those who need it. Is healthcare a part of that mission, and how do you do it?
Yeah, so our goal is to have people look at healthcare differently. I think when you speak about healthcare, it's always been about medication or going to a hospital or a clinic. I think health starts right in your house, amongst your family, and in your neighborhood. So it is the air you breathe, it's the water you drink. It is if you have enough water to drink, if you have food, what you wear, how you feel about yourself. There is mental health has a lot to do with physical health. So trying to make professionals, organizations, as well as residents understand that when it comes to health, it starts right here. You don't have to wait till you go to the doctor. Do you feel healthy is the question. And the second thing is access to anything that's required for health has to be also viewed differently. I think that those days are gone when you have to go to a brick and mortar for everything. If anything, COVID has taught us is that you have to be prepared with a backup plan because there can be times when you are stuck in your house. So misconceptions towards that is that people don't have internet in the rural areas. The two areas that we serve, La Sara and San Carlos currently, we have done a survey, and in La Sara especially, 91% of the residents have internet at home. They just don't know that it can be used for things other than streaming. So there's a lot of digital literacy scope there. But telehealth services, accessing educational programs that can be online, accessing other resources. All of this can be done from the comfort of their home. And it's not about comfort when it comes to them. It's just that it is in the middle of the nowhere in La Sarra. There is not enough transits and transportation. It is hard to go anywhere. So viewing access differently is also another focus. As you mentioned, insured population as it is in our area is lower as compared to the rest of the state. We have about 40 to 45% uninsured population, and that number will go up higher because of the changes. So when it comes to underinsured or uninsured population, it's hard for them themselves to prioritize their health, and then with the times coming with the reimbursement changes, it's also difficult for institutions and providers to figure out how to do the continuity of care, because it's no longer about seeing the patient one time. It is about how to keep them healthy. So from our vantage point, what we try to do as a direct service, which is free to the community, is whenever we go to the community fairs, we provide free laboratory services. The reason being, when you have a diagnosis, when you have some metrics of what's wrong with an individual, it's easier on the organization to take care of them, as well as it's easier for the individual to focus. And that was one of the biggest missing gaps, where people don't want to do the labs, but they are okay with doing the treatment. So we're trying to address that. And again, we see the need is going to increase for those kind of services.
Now, tell us a little bit about La Sarra. Where is that located?
It is a beautiful little town in Willacy County. It's about 25 minutes away from Raymondville and about 40 minutes away from Harlingen.
And Willacy County, for those watching, is near the Gulf, and it is just a county north of Cameron County, which is actually on the border with Mexico. So, but it is right near the Gulf.
Yeah, and they are literally in the middle of nowhere. If you put La Sarra on your Google Maps, you won't get to La Sarra. You'll
I've
get
never heard of
else.
it, so I had to ask you. I'm like, I know a lot of towns down here. I was not familiar with that.
Yes.
So what I'm getting from you is it's a lot of teaching people how to help themselves, also giving them a baseline. Here's your blood pressure. Here's basic health information on yourself. And then if something happens to you, maybe utilize the internet to maybe look up some resources before just perhaps running to the emergency room.
Yeah.
But, educate yourself, but here's a little helpful hints, and then knowing who to turn to for help also.
Yes. So we have done 2 successful community fairs. We have taken about 45 new partners to that area, and who are now familiar and connected with the community service center. So the residents are aware of a lot more resources than they were aware of in the past. Also, 911 emergency service was something that was an issue there, because they are not on the map, they are not on the 911 portal. Even when they call 911, it was hard for the service to get there because they would get lost. So we were able to do a campaign along with LRGVDC, Know Your Address campaign, and help about 35 families get their addresses appropriately onto the portal. And this time when we went back and did the survey on how they are experiences the 911 services, I think that problem was sort of resolved.
Now, is it a colonia or is it near colonias, and do you help colonias? And for those people who aren't aware, colonias tend to be areas that don't have normal hookups to water, electricity, most of the amenities that a community would have.
Yeah, so these are all outside city limits. They are classified as colonias, extremely rural. And as I mentioned, there are several colonias. And based on that research, there are some green colonias, which are still rural, underserved, but you have good community-based organization activities already happening there. The ones where we are going are literally places probably even the organizations have not heard. And that's thanks to that research done by UTRGV.
Now, I have to ask you, because I know you're from Mumbai, India, your background. I mean, what made you want to come to the Rio Grande Valley and help people here?
Yeah, so before Rio Grande Valley, I was in Tampa, Florida. But honestly, I think the definition of being in America for an outsider and living your American dream and having the opportunities, I got it all here in the Rio Grande Valley. My career flourished here. I found purpose as a healthcare professional. The limits were endless. So work brought me to Rio Grande Valley, and then the uniqueness of the culture, the people that connected me to my home.
You saw a need.
Yeah.
You saw a need. Similar to India?
Very similar to India, and that's why we started this non-for-profit, because like I said, I was in the healthcare system for the longest time. But this hit home, and it was a calling from above that, okay, it's the same thing that you grew up seeing, so help the people, and this is your home.
And now I understand you do have another upcoming event. It's called a Community Care Closet next month in San Carlos. Tell us, what is that?
Yeah, so Precinct 4 has been one of the areas through which we are able to
Hidalgo
serve.
County.
Hidalgo County Precinct 4, Commissioner Eli Torres' endowment center. We've been able to do a lot of activities through that center, and recently we were granted a little space inside the endowment center that we are now transitioning it into a community care closet. So individuals can come there, pick up clothes, professional clothes, casual clothes, bassinets, essentials for children, essentials for home, like pots and pans, some cabinets, whatever we have available, and we will strive to make more availability. They can come and pick it up for free, so that, that's one thing to less worry about in all the crisis.
And so there's I guess it's a grand opening, November
18th. It will be at the San Carlos Precinct 4 Endowment Center.
And then it'll
at
be
10
open
a.m.
to anyone
Yes.
for their needs. Okay.
Absolutely. It's just located there, but anybody is welcome. And hopefully in the future, we can also do it a more mobile concept where we can take some of the stuff to the other areas.
Well,
too.
I think as long as this government shutdown continues and
Yes.
finances are up in the air, you probably are going to have a lot of people take you up. There's a lot of need out there, right, Rudy?
Absolutely.
Oh, yeah, definitely.
Absolutely.
Well, thank you so much for joining us, but we are unfortunately out of time, Dr. Chandran. We've been speaking with Dr. Rashmi Chandran, President and CEO of the Alta Care Foundation. It's a nonprofit that helps underserved populations in the Rio Grande Valley get access to the things they need. Thanks again for joining us today,
Thank
ma'am.
you for having me.
Thank you.
Border Report Live is back in 1 minute. Welcome back to this edition of Border Report Live. My name is Rudy Mireles. I'm your host here in Harlingen, Texas, in the Rio Grande Valley of deep South Texas. Got one more headline we wanted to share with you before we head out for the day, and that is Mexican officials on Monday held an open house for El Paso and Juarez news media for the ongoing work inside the Torre Centinela, also known as the Sentinel Tower in English. Now, this is an $84 million building, and its technology is the state of Chihuahua's gamble to keep criminals in check by taking something away that they have long enjoyed, and that is operating with impunity. Now, with the use of electronic screens, officials will be able to see and operate all the security cameras throughout the entire state of Chihuahua. 400 people, including computer technicians, crime data analysts, and police officials will be working in the tower, which should be open early next year. It's pretty incredible stuff there. Looking forward to seeing what the outcome is and what this looks like. Almost looks like something out of one of those Minority Report movies or something out of the future. It looks pretty interesting. Should be interesting to see what this does for the crime statistics in the state of Chihuahua as well. So we'll be on top of this for you. I'm sure our El Paso correspondent Julian Resendiz will be monitoring this operation very closely as the project develops and becomes operational sometime next year. Did want to remind you that just in case you missed our incredible conversation with the president and CEO of Alta Care Foundation, Dr. Rashmi Chandran, maybe you're just joining us on Border Report Live at your local Nexstar station. Don't worry if you're just joining us, though, because you can always catch up with us, and not only us, our episode every day, but you can stay informed on all the stories shaping the U.S.-Mexico border, as Border Report Live now brings you real-time updates, expert insights, and voices from both sides of the border in audio form. We're talking podcasts. You can listen now at any of the apps that you see at the bottom of your screen there. That's Apple Podcasts, the iHeartRadio app, Spotify, as well as YouTube. Also wanted to remind you to check out our partners at Political Power Ranker. It's a weekly show tracking the movers, shakers, and rule makers in American politics. Nexstar's Director of Political Content, Chris Berg, and Director of Emerson College Polling, Spencer Kimball, break down who's up and who's down in the world of politics based on my favorite thing, data. So make sure to check it out. You can find more on Political Power Ranker at abc27.com or your local Nexstar station's website. That is going to do it for us today. For our South Texas correspondent, Sandra Sanchez, my name's Rudy Mireles. We'll see y'all tomorrow.